Okay, brilliant. Should we get started then? Perfect. Okay, so hi everyone. My name is Jeannie. I'm a second year medical student at Barts, and me and a couple of others here are here to speak to you about life at Barts and just some interview advice for you guys with your interviews coming up. Um, so yeah, let's begin. Um, can you change the slide? So this is what we're going to run through today. So firstly, I'll tell you a little bit about Bart's Medical School in itself, what's special about it, and why you should apply, and just some interview advice talking about the themes that they might ask you about. Um, and then we'll go on to some practice questions where you guys can have a go at answering a couple, and then we'll give some feedback and some answers with a framework that would be good for you guys to follow. And we'll also give you a bit of an insight into life at Barts, whether that be societies or extracurriculars and supercurriculars that you can get involved in. We'll also do a little Q&A and we will discuss the article, seeing as that is half of the interview that they will run. Um, so we will pretty much cover all bases today. If you guys have any questions, feel free to use the chat, or I think we can specify when we're open to questions so that it's not just chaotic at once. So we also do have a Q&A, like I said, so we will make sure to answer the questions you have. Next slide, please. Lovely. So let's start with just some information about Barts in general. So it is the oldest medical school. St. Bart's is, yeah, pretty much the oldest medical school in the country. There are three medical campuses that you will be at during your time here. And we are affiliated with some very good teaching hospitals in London. For example, the Royal London Hospital, which is in Whitechapel, and St. Bartholomew's Hospital, which is near St. Paul's Cathedral. Barts also has cutting edge research. They are kind of at the front line of research at the moment, whether it be cancer or um, like heart and things like that. So you can research about that in your own time, but they are definitely at the forefront of medical research at the moment. Next slide. So yep, like I said, oldest medical school in the country. These statistics are from last year, but I imagine they probably haven't changed that much. So you can see we are first in London at the moment for medicine and dentistry. We are one of four partners in the cancer research. So, like I said, at the forefront of research at the moment, and we are fourth in the world for research citations as part of medicine and dentistry. Next slide, please. So, as I said, we have three campuses. So, um, let's start off with the Whitechapel campus. This is the main uni campus for Bart students. So, you will have sessions like PBL here, and lectures. This is all based in Whitechapel. Um, so, you will be here for majority of your time. Um, Mile End is the main Queen Mary's campus. So although you might think, oh, Barts is part of Queen Mary's, kind of is, but Mile End is more of the general Queen Mary's campus. However, you would have sessions, for example, labs or some specific classes, I suppose, in Mile End. And then West Smithfield, like I said, that is so Charterhouse Square, which is near St. Paul's Cathedral and near St. Bartholomew's Hospital. You would have clinical skills here, um, and communication skills. So that's where they'll teach you about examinations you can carry out on patients, as well as frameworks you can use for taking a patient history or things like that. They have teaching sessions at West Smithfield. At each of these campuses, they also have their own individual libraries. So, if you want to get on with revision after your labs or after clinical skills, you can use their libraries there as well. Next slide, please. So, as I said earlier, we have two main teaching hospitals, which is the Royal London and St. Bartholomew's. Next slide, please. Oh, waiting room, yes. Let me admit everyone actually before I continue. Okay. Um, so yeah. Like I said, forefront of research. So Barts is home to a very significant cancer research institute, and as you can see, they are uncovering a lot of new things about cancer. Um, so if you are interested in research, it's a very good thing to look into for your interview, and you can mention it as a reason of why you want to come to Barts. Next slide, please. Okay, so let's move on to the big question, which is why Barts? Um, these are all some very important points. In your answer, you will not have time to include all of these, so I would say pick maybe three or four that are most important to you. I will talk through them all just so you guys are aware of what each point means. So let's start off with early clinical experience. I was in first year last year, and in first year we have GP placement once every 2 weeks. So this is quite unique to Barts because not a lot of medical schools would offer early clinical experience from first year onwards. And I think we all found this quite beneficial last year because we were able to start talking to patients and start getting histories from patients in a very calm setting. And it just made working on communication skills alongside lectures and theory a lot easier. I think communication skills is probably the same level, if not more important than your scientific knowledge. So I think early clinical experience is definitely very good. It helps you build on those people skills. So next, PBL. So this is problem-based learning. Once again, you start this from first year, and I have this now as well, and you'll probably have this for quite a few years of medical school. This is basically where you are in small groups and you get given clinical scenarios each week, and these relate to the lectures that you have that week as well. And as a group, you kind of discuss the main themes regarding the scenario. You talk about the keywords and you kind of annotate it and dissect it and kind of see, okay, what's important, what's happening with this patient here, and what can be done about it. And once you've discussed all of this, you go away and you research some learning objectives that you guys would come up with. And then the next week, you'd come back and discuss it further before moving on to the next scenario. So I found PBL quite useful because working in small groups, it's once again a very chill environment, but you get to see different perspectives. You get to discuss what you think is important in that scenario. And you also pick up on things that other people would say, so you can teach each other and learn from each other. Um, if some of you guys revise better with people and kind of teaching each other concepts, then this could be a very good thing to mention. And you can definitely say that it would align with your current methods of learning, I suppose. Um, Another thing, obviously, is that it aligns with what lectures you're doing that week, which I found very useful. It really helps solidify what I'm learning. So you can also mention that. So next, prosections. So the way they teach anatomy at Barts is through prosection, which basically means that the cadavers that they have are already kind of cut and prepared, so that it's showing specific structures that you're learning about in that specific lab. Um, I mean, there's always going to be a debate, prosection versus dissection, but in this case, I think prosection is quite useful because you can focus on that specific structure that you're learning. You are also allowed to get gloves on and really kind of feel the part of the body that you're looking at and kind of move things around and see how things work. So, obviously, with a big cadaver in dissection, you probably wouldn't get as much time to focus on a specific structure, but with prosection, you would. So, that is quite a positive thing. Um, this point about the spiral curriculum, I think, is the most important point. I always emphasize this when I speak to people applying to Barts. I think I can't stress it enough. Spiral curriculum is basically how they teach the course at Barts. So I'll define it for you, but obviously, if you were to mention this in your interview, there's no need to define it to the interviewers. But it's basically where in first year, they'll teach you the fundamentals of each system and kind of what happens normally. So when things are going right, and it's not no pathologies at all, literally just how do things work. Then in second year, you will go back over things, but you will look at pathologies related to these systems. So, for example, last year in cardiorespiratory, I learned about how the heart and the lungs work. But this year, I had to work on that knowledge and look at what happens when things go wrong in those specific structures and these specific systems. So it reinforces and builds on my knowledge from last year, but adds more to it. So it kind of deals with like long-term retention and kind of active recall and going over things again and again, which I think helps me learn better. And if you were to mention this in your interview, then I think it's good to definitely say it aligns with your learning style because um, obviously long-term retention and things are a pretty good way to learn. So I would think that's a very important point. Um, Next are student selected components or SSCs. These are basically every year you will have two-week blocks of time, and that's where you can choose to learn about something beyond the core curriculum. So the uni will provide you with a list of things that you can choose from. This does include dissection, as well as self-organizing your own placements. But yeah, basically during SSCs, you have time to build on knowledge in a field that you want to learn about. So when they say you can self-organize in a placement, that means you can literally email a doctor in whatever department you're interested in, and you can literally just do your own placement for 2 weeks and you can tailor it to whatever you want to do. So I think it's very useful. As I said, we do prosection at Barts, but last year I did dissection in my SSC and I found it so incredibly useful. So I think it's very good to have the choice to do dissection. Some people may not find it useful, some people might. And having the choice to experience both, I think, is very beneficial. So it definitely allows you to learn beyond the core curriculum and tailor what you're learning. And it kind of helps you make your career choice in the future. If you did a placement during your SSC and you thought you liked this department, then you can build your portfolio from there onwards. So I think SSCs are very important. Next, intercalation opportunities. So Barts offers intercalated degrees at a bachelor's and master's and PhD level. So BSc and MSc are all 1 year, but you can interrupt your medical degree from year three onwards and do a 3 year PhD and then go back to medical school if you want. Um, and I think this is quite unique. Not a lot of unis offer this. Most unis only offer bachelor's as well, so being able to even do a master's is definitely quite unique to Barts. Um, if you are interested in intercalating, that would probably be a good thing to mention. Next, societies and programs. So this will probably be touched on later as well, but I would recommend looking on QMSU and also the Barts website and just kind of seeing um, what societies appeal to you and what you think you would join. I always go with rule of three for this one. I would say think of a sports society, a cultural society, and an academic. You don't have to do all three, but I that's what I found was best. Um, but yeah, I'd say maximum three, but societies I think are a very good way to kind of look and be like, okay, if I come to Barts, I want to do this. And the interviewers will hear that and think, yeah, they definitely thought about coming here if they want to join this society already. So I think it's pretty convincing to say that. In terms of programs, they also offer a lot of programs here. Once again, probably will be touched on later, but they do programs related to trauma medicine and pre-hospital care. So those programs start from first year onwards, which are quite good to look at. Um, Next, student support. Barts has a very strong student support network. Once again, you can read this on the website. They are very helpful, especially when it comes to specific learning needs and things like that. They will make adjustments for you as per needed. And even if you're unsure and you want to find out if you have anything like that, they are also very supportive about that. And location. So we've already discussed Bart's main campus is Whitechapel, but this is all in London. And I think being in London is a very cool thing to say that you're in uni in London. Very diverse area, especially Barts. It's in East London, which is incredibly diverse. We will touch on that as well. But just talking about being in London and getting to experience a bunch of things would also be quite a nice thing to say. Okay, next slide, please. Okay, so as I said, Whitechapel in East London is very diverse, and they might ask you things related to that. For example, they might ask you, what is more prevalent in East London or Whitechapel? And if you've been to Whitechapel before, you would probably know that there is a massive South Asian population, as you can see written on the screen. And when it comes to South Asian populations, that means that the prevalence of certain diseases are going to be higher in Whitechapel compared to the rest of the country. For example, type 2 diabetes mellitus, or you can think about comorbidities related to that, like cardiovascular disease. Um, this is definitely something to look into because it's very likely that they'll ask you questions about this. And some conclusions that you can draw from learning in such a diverse environment is that this is an opportunity that is so unique to Barts because um, in other parts of the country, you might not be placed in areas such as diverse as this. And if you're on placements, then you're going to see certain diseases pop up again and again in specific ethnicities. And being able to learn in this kind of environment means that you can see how different diseases are managed differently between different ethnicities. Something I learned in first year, even as part of like lecture content, is that um, with hypertension, for example, you can't prescribe the same things to some people of Afro-Caribbean descent as you would to someone who isn't, because they're genetically predisposed to having a worse reaction to that drug. So learning it in a lecture is one thing, but you would actually be able to see this happening in hospitals and things like that. So I think it's very beneficial to be learning in a place like Whitechapel, and it's worth researching into the demographics of East London. Next slide, please. Okay, so with common interview themes, as you can see on the screen, these tend to be what they would ask. So motivation and reality of a career in medicine and how you would contribute to uni life. So I've already told you why Barts and I mentioned societies, programs, and location, but they might ask you, what can you contribute to this university? In which case, it's very important to look at societies, as you can then think what you would join and what you would contribute to life at uni. Um, Qualities as well are quite important. So qualities of being a good doctor, like communication, teamwork, etc., and taking initiative and having resilience and maturity. Um, Article research and analysis is going to be half your interview, so definitely very important as well. Okay, so this is our first example question. So, what would you find challenging about being a doctor? So, I've put some bullet points below, and these are things that would be nice to mention in this answer. So, obviously, you don't have to mention all 4 points, but for example, challenging about being a doctor, witnessing patient suffering and breaking bad news. Definitely not something you'd experience in every career. Even maintaining a balance between emotional investment and empathy and not having a solid routine. So these are just examples, and I think when you answer this question, link it to a work experience or anything that you've probably experienced before, whether it's volunteering or um, if you've been in a hospital on work experience before. These are just some examples, but um, yeah, I would just say link it to a previous experience. So how have you developed your communication as the next question? Um, so if you guys haven't heard of STAR before, then I would say definitely look into that. that's a good framework to follow if they ask about qualities, even if they say, how have you developed your teamwork or anything like that. STAR is a very good way to answer the question. And then these are just some parts, I guess, like qualities of communication which can be mentioned. Um, Once again, you don't need to mention all one, two, three, four, five, six of these, maybe three, and tie it to what you've done before. I'd say with these questions, it's very important to focus on the phrasing of the question. How have you developed your communication? Not tell me about a time you communicated well. Um, Not talking about did you find communication hard to develop? Like it's nothing like that. You have to focus on the phrasing of the question. Um, Next slide, please. Okay. Third example, a patient has HIV and doesn't want to inform their partner. How would you, as a doctor, respond? So, this is one of the ethical questions that you could possibly be asked. In these scenarios, it's very important to think of the four pillars of ethics. So that is autonomy, non-maleficence, beneficence, and justice. And you can see I have written these out here. Even confidentiality, arguably a fifth pillar, but yeah. Um, think about those as you think of your answer, and that should hopefully give you a rough framework in your mind to answer. Um, yeah, I think that's it. Okay. So, in terms of an insight into life at Barts, here are just some examples of things you can get involved in. So, that top left picture is my Christmas dinner last year with Volleyball Society, but every sports society has their own Christmas dinner. You can get involved in the arts. So, for example, BL dance, drama, Zebraphiles, which is the kind of comedy and skits part of drama, as well as music. Music has things like opera, not opera, sorry, orchestra, live band, and things like that. So there's a lot of things to get involved in. This is Women in Healthcare Society. I went as a fresher and I found it to be pretty inspiring. So if you are interested in societies like that, then would recommend for sure. There is a picture of Netball Society at the bottom left, I think. So just reinforcing that there's a lot of sports societies that are nice to join. Um, Pre-hospital care program. So that is the program I mentioned that is to do with pre-hospital care, obviously, as it says. Um, yeah, so this program I think runs for 4 years and you get to experience very cool things. For example, you get to shadow, I think, paramedics and people driving ambulances, and you get to attend to calls that are quite urgent. And because it's in London, especially East London, you will see some very interesting things being part of PCP. So Whitechapel, especially so the Royal London, I guess, is home to the London Air Ambulance, which is the helicopter you can see, and pre-hospital care program. You would be able to see more about this as well. Um, T-SCIP, which is the Trauma Sciences and Care of the Injured Patient program, is in another 4-year program, which you would start from first year. Um, I think in this you would see more in A&E and the trauma ward of the Royal London. So once again, brilliant clinical exposure, and definitely worth looking into from first year.
Just to add a couple things here and to answer some of the questions in the chat. So people are asking basically if it's likely that that question about HIVs, would come up. Generally, the questions tend to be more on personal insight. You're right, and kind of ethnic inequalities in healthcare and things like that. But it's not like I wouldn't be completely unsurprised. I wouldn't be completely surprised if they did drop a question, something about ethics and professionalism. So it's probably wise to prepare for all outcomes. And anyway, if your other interviews, you'll probably end up preparing for something like that anyway. So I don't think it's too much of a curveball for them to ask a question like that. So and that's for that question. Secondly, the 10 minutes is for the article. Yep, that's right. So I think my interview went a little bit longer than the 20-minute interview time, and that's likely to happen depending on how long you speak during yours. So yeah, you are likely to get asked like maybe two, maybe three questions in that second half on that about your personal insight. Generally, I think for me it was only two. So so yeah, that's you won't get asked loads and loads, but so you won't get asked like four questions, but you will get asked two or three. In addition to that, just a few things to say about PCP. In first year, you won't be able to shadow paramedics or anything, but they have monthly forums. And when you go into the forums, you'll be able to listen to accounts from different healthcare professionals. So this month, there was a professional who talked about ECMO and its use on the field. So that was very interesting. And you have about three professionals that come in and give 45-minute talks. So that's for first year. And if you have consistent attendance over the first year, you have the opportunity to sign up for PCP as a program past year one. And that will let you do some very cool things during throughout the year, which will be things like running shifts with the paramedics team. So you will be able to go with the paramedics and shadow the paramedics throughout the year. And so another question here, do they cut you off from speaking? I found personally they didn't cut me off and they did let me keep talking, especially for the article bit for a long time. So in terms of how long you should speak per question, generally if they ask you a question, let's say the question is summarize the article, I'd or maybe something like why does poor housing affect healthcare or something like that, then I'd say between 3 to 5 minutes is a good timing for that. So yeah, that's my thing.
Thank you. Yeah, those were some there were a lot of questions in the chat. One question I did want to answer verbally rather than on text was about the HIV question. A lot of people are confused about the confidentiality bit. If you could just pop back to the HIV question, I will quickly explain that and then we can move on. Um, so I wrote about confidentiality. So it really depends on what the patient says. Because they don't want to inform their partner, it puts you in a bit of a bind because if this patient and their partner are sexually active and this person is not willing to disclose this information to their partner, then it's putting someone else at risk. And as a doctor, it's your responsibility to kind of prevent that. With confidentiality, there are things that can be a bit iffy. Usually they'll be like, oh, don't break patient confidentiality. But when it comes to safeguarding or if there's a danger to the wider society, then there are certain cases where you can break confidentiality. And in this case, I think first what you would try and do is encourage the patient to tell their partner. Don't just go behind their back immediately. You do also want to be approachable and kind of give advice and try and educate this patient. So if they're not willing to tell their partner, try and find out why, and try and encourage them to tell them. And if this patient is incredibly reluctant and wants to continue being sexually active with their partner and not telling them, then as a doctor, I think you would have responsibility to tell the partner about it. Um, I think there is a YouTube video online by Ali Abdal about ethics, and he talks about confidentiality in one of his videos. I would definitely recommend watching his videos when it comes to ethics, as not only does he talk about how you should answer questions with ethics, but also about some of these particular scenarios where you might have to break confidentiality. I hope that all made sense.
So there are a few more questions in the chat. There's quite a few, so I think we'll leave that to the Q&A at the end. Just before we go, do any of you have anything extra to say about life at Barts before we go on to the article?
Um, I mean, I think I I wasn't here for the very beginning bit, but the three campuses, it's worth mentioning how you have three very distinct types of campuses. At Whitechapel, you get one view of medicine, and at West Smithfield, you get a more kind of historical, and then also the types of hospitals at the different campuses. Um, at West Smithfield, you have St. Bart's, which is more specialised tertiary care, and at the Royal London, it's more acute types of care. So you get different types of exposure to different types of medicine, which maybe is something you can mention in an interview. And you kind of don't get this very isolated view of medicine. You see it as something that's diverse and that um, kind of you get different perspectives of it.
And having access to both of these hospitals is pretty good, especially if you're a very kind of proactive first, second, third year. For example, the PCP program we were talking about earlier, it arose when a student decided they'd like to shadow a paramedic, and they just went up to one of the paramedics at Royal and asked if they could shadow. So there's a ton of opportunities there once you get into med school in terms of placements, research, internships, and things like that. So that's something to keep an eye out for. In terms of research, I'd just like to make a few more points, just a few additional points about things you could say. So obviously in an interview, it's very important to be specific about everything, and that just improves the quality of your answer because it shows that you've done your research and you have an insight into both the university and medicine as a career. So for that purpose, when you're looking at these kind of research elements, I think it's useful if you look at particular examples. So if you go onto the Queen Mary's website, you'll find different sections for the Cancer Research Institute, the Cardiovascular Research Institute, etc. And there'll be research questions on there, for example. Back. So, for example, can molecular signatures drive discovery and precision interventional clinical trials to improve outcomes? And things about pancreatic cancer, early stage lesions, and breast cancer. So, if that's something you're particularly interested in, or you've done kind of super curriculars in, then you can weave them into your answers and say, oh, um, in the past, I've been particularly interested in looking at early stage lesions in breast cancer, and this is linked to the research at Barts. And being close to that research would provide me an opportunity and an outlet for my passion for this subject. So that's a good way to look at it. So I suggest looking at the websites for these different things, and you'll find some really interesting research in terms of kind of digital twin technology for oncology, new procedures in cardiothoracics and interventional cardiology, and things like that. So that's something I'd suggest looking into, if, especially you're someone who's particularly interested in kind of the research aspect of medicine, or if you're interested in something like pursuing the MB PhD program. And that could be something you're interested in. So again, something I wanted to add here was, in addition to PBL, they're also trialing something called TBL. It's not officially part of their learning style, but it's, I think, also quite an interesting thing you could mention. So you could say, oh, whilst I was talking to some Queen Mary students that are at the university at the moment, they mentioned they're also trialing team-based learning, which is TBL, which is essentially, again, working in a group, but you have both an individual learning element and a team learning element to it. So again, as Jeannie was mentioning earlier, whenever you're talking about the learning style of a university, it's very important, again, to personalize how that learning style would suit you. So you have to be specific about how PBL or TBL matches your own learning style. So you might say, so one of the students that I've been working with had quite a good example of this, and he said, oh, for chemistry this year, I found isomer questions particularly difficult, and I found that working in a group and doing questions in a group helped me learn how to do these questions in particular. And this matches the style of learning you'd have in PBL and TBL. And because it matches my learning style, I feel like the the style of teaching at Barts is suited to me. So that kind of logical thinking and cohesive linking of both the teaching style at the university and your own learning style is something that can really personalize your answer to why Barts, because a lot of people will tend to say the same things. They'll say a lot of these things as part of their answer. So personalize your answer is something that can set you apart from the crowd. Um,
Also, sorry, just to add for societies, another thing you could add is if you have any specific unique interest, it could be a good thing to kind of say, I'm looking to make this new society. Um, I mean, that might not be everyone's goal, but it could be something like to add to Rishik's point about making your answer unique, mentioning unique pieces of research, mentioning what societies you want to join, but also mentioning what you want to bring that's new to Barts could be a good way to do that.
yeah. So yeah, and then again to add to this early clinical experiencing, I don't know if Jeannie mentioned, but every 2 weeks we go on our GP placements, and that's early in year one. So that's a very useful experience. You get to sit in on GP clinics. It's essentially a really useful placement. And whilst there's this kind of diverse demographic of Whitechapel, you're not only exposed to that demographic. For example, my GP placement is in the leafy suburb of Walthamstow. So I have kind of a completely different experience in Walthamstow than I do in kind of Whitechapel, and that difference between those two demographics is obviously very representative of the population itself, because the population is going to have very diverse differences in ethnicities, wealth, etc. In terms of spiral curriculum, I just want to add one more thing about first year. So Shrija and I are in first year, and despite them teaching you how everything works in first year, like the normal physiology of different systems in the body, there's also they do sprinkle in little bits of what things go wrong as well. And I find that this is useful because it kind of sets the foundation for second years as well. And the reason that's cited often for spiral curriculum being particularly effective is that it forces you to do active recall in the second year. So once you get into second year and you're starting to learn about how things go wrong in the heart, for example, you have to go back to year one and you have to revise what you've done. And that means that you're creating a really strong base, and obviously having a very strong base is important to being a good doctor in the future. Um, in
Um,
terms of SSCs, apart from dissection, there are lots of interesting opportunities as well. So, for example, there's an ultrasound module. There's also modules in there's a Muay Thai module, I think. In this time, there's, I think, two people doing it this year. They have to teach certain groups of people how to, teach Muay Thai to certain groups of people. So that's something. And in terms of intercalation opportunities, there's both internal intercalation opportunities where you can do things within the university, and also external ones where you can go to other universities. And the prerequisites for those vary, but those aren't, entirely necessary for your purposes as an applicant. Um, but if that's everything, I think we can move on to talking a little bit about the article.
Just to answer a couple of questions on the chat, because I think it might be better spoken. So someone asked, how do you make your answer unique? You don't have to be the most unique person in the room per se, but I'd say link your skills more to how it kind of links to medicine per se. So not just stating, for example, in your work experience that you saw teamwork within the MDT, but state how this is important in healthcare, how this benefits patient care, and also back it up with how you've shown it. So if you stated that you've shown teamwork, don't just kind of name drop that you demonstrated teamwork in a particular context, or state just elaborate on the context for too long, but rather show the specific sub skills within teamwork. That kind of shows that you have a good understanding of teamwork as well. So within teamwork, it's kind of built upon soft skills of empathy and communication, and speak about how you did that effectively in the team. Someone else spoke about repeating the benefits of the diverse population of East London. So I can speak about this. So yeah, I'm from East London. I don't go Barts per se, but I did grow up in East London, so you do get to see the effects of socioeconomic deprivation firsthand. So when we treat patients, we use the biopsychosocial approach of healthcare, and we see how different biological, psychological, and social factors interact with one another and can cause one another as well. And it's kind of a cycle. So East London, I think Whitechapel is one of the most deprived areas of London, and you get to see how things like maybe your financial situation can maybe cause you to be depressed, or you might not be able to afford organic foods or a gym membership like other people can, and that can make your health deteriorate more than maybe other people can. So you can link this, I guess, to the postcode lottery and Julian Hart's inverse care law, and you get to see how you've seen the effects of this firsthand before you actually go into your medical career. Another thing about London itself and East London is that because it is so ethnically diverse, and you get to see patients from a large demographic, you are exposed to how different demographics, how health is different for them before you actually are an F1, and you are exposed to a demographic reacting to healthcare differently, and you've been exposed to that early on. So as Jeannie says, so obviously as South Asians are more genetically predisposed to type 2 diabetes. We can we explore how we perhaps tailor our public health campaigns or treatment to people of a South Asian population or people who don't maybe speak English natively through integrated care systems, etc. And yeah, that's just all adapted in your medical school learning as well. So just being aware of like the large South Asian population and how, a lot of people don't speak English natively. So we get to see different factors affect healthcare and it does prepare you for your life as a medical student as well.
And just to add to that quickly, I know we're running out of time, but I'll be quick. So the first lecture we had during, not lecture, the first talk we had was in our offer holiday, and there was a real emphasis on the fact that being in Whitechapel and having this kind of diverse demographic means that the number of conditions and the types of conditions we'll be exposed to will be different compared to at other universities and other parts of the UK. So that was the kind of main point to take away. And obviously Khadija expanded onto quite a lot of the other important factors about having a diverse demographic. So moving on to the article. So this is an article. This is the article we got last year. We're allowed to share this. Obviously, we're not going to be allowed to talk about the article that you've been given this year. Someone asked, does everyone get the same article? Yes, they do. And essentially, I'm just going to talk through how you're meant to kind of tackle this. So before I do that, this is something I said doing. So for your university, have a brief overview and have like list out all of the main points and the kind of things you're interested in. And this will be particularly useful when you're asked about why Barts, which you might not get asked to, but it's good to have a background. And also you can see whilst I was preparing, I have a slide from this session last year. But there's a section here about tackling the article, and this is the main takeaway, and it's this acronym of PANDA. So when you're analyzing the article, what they're expecting you to do is critically analyze what's being said in the article, your own opinions on the article, different perspectives people might have about the article, and then kind of current affairs around the article, because obviously when they give you a topic, it's going to be something quite current. So purpose of the article, why is the article being written, and then the author is and who's it written by. When it's who's it written by, so that doesn't just include the author, so it doesn't just include Gareth, it includes also the BMJ. And obviously, certain institutions, certain journalists, certain news companies will have, um, left or right leaning voices, etc., and that might affect how they portray a different problem. So that could be quite useful in framing what you say about the article. So nature of the article, as in what's the article saying, what's the style it's written in, etc. The date in which it's written. So this can be quite important in terms of, for example, for this one, what date is it written in? When was the bill's first vote, etc. And it's also relevant in terms of in other contexts. So you can look at the time period, because, for example, if it's a short time period versus a long time period, are the critiques that the article are making about an issue relevant or even feasible based on the time period? So, for example, if it's an overly short period, there's not going to have been enough information to make a kind of proper judgment. So that could be something. And the audience, who's this? So obviously, this one is generally for kind of people in the healthcare industry because it's written for the BMJ. But the audience is also important because that influences the tone and the style in which it's written, which can affect how the information is being portrayed. So in going back to the article, so the article it's not going to be very long. It's not going to be particularly complex. It's not going to be something, I think you've already all got your article. So it's not going to be something particularly heavy on the kind of scientific element, etc. And one of the main questions I get asked about tackling the article is, do I need to remember all the names and the quotes, etc.? No, no, you really don't. You don't really need to remember all of the specific names and the quotes. Sometimes it can help add to the quality of your answer if you remember little bits, but don't force it. You don't need to remember quotes. Some people make flashcards to help them remember different elements of the article. That's sometimes a good way to do it. I didn't find it useful myself. I'll show you what I did in a second. The only notable name here that I might remember would be Kim Leadbeater. So if there's a significant name that you'd like to mention, someone big in the kind of political sphere or the current affair in particular, you can mention their name. That would be quite a useful thing. But you're not expected to remember all the names and the quotes, etc. Now, the thing I think is important when tackling the article in particular is to find your own unique perspective on the article. So, what I'm saying when I say this, I've said unique quite a few times in the interview in this kind of session, and that's because I believe that the key to being a standout student was mainly three things. So, it's enthusiasm, eloquence, and specificity. So, specificity links in with uniqueness, and if you can find your own unique perspective to tackle the article with, then you'll probably raise the quality of your answer. So what I mean by unique perspective on the article is what's about the article, is there some element of the article that you're particularly drawn to and that you can make a particular insight about? For example, so I'm going to show what I did for my article. It can be a little intimidating to see because I've just made a lot of notes, but this is like honestly, I think I did quite a little bit too much for preparation for this article. But you can see that I've annotated different parts of the article to um, tackle different thoughts I had about them. So, for example, expected to die within 6 months. The time frame is arbitrary. Public unease and outrage. Does it apply to anyone with chronic pain conditions? And should they be entitled to it? Pros and cons. And generally, pros and cons is a very good way to do it. So you can talk about the pros and the cons at the same time. But sometimes separating pros and cons can so compartmentalizing your answer into pros and cons can kind of make some of it lose value. So it's better to evaluate throughout and kind of talk about pros and cons at the same time. So yeah, essentially this is what I suggest doing with your article. Go through, annotate different parts, think about what comes to your mind when you read it. So I've done a lot. You don't need to
Yeah.
do this much. And then on top of that, it's very important to have kind of extra context. So this is what I meant in terms of a unique perspective. This is what I thought. This was essentially what I thought would be a bit of a different perspective. And essentially, it's the idea that does being part of a particular party make you more inclined to vote for or against the bill? And so does the number of seats that are in Parliament affect whether the bill is voted for or against? So for that, there's a lot of stats. I don't think I said very many of these. I may have said one or two in the interview, but again, it's not important to remember the numbers. It's not important to. It's more about the analysis itself.
Yeah, I'd also say that it's more balancing between what's said in the article and with your own thoughts. Is they're going to be less impressed by you remembering specific like statistics from the article and more have you develop like a proactive, thoughtful approach to the what the article's saying essentially. And you don't have to limit your knowledge to just what's said in the article as well. You can back it up with other points as well. So I don't know if this is a good time to mention, but I mentioned something called the Liverpool Care Pathway and I drew parallels to that to the assisted dying bill. It's not directly the same. So the Liverpool Care Pathway was like stopping treatment essentially, where the assisted dying bill is more of a proactive approach. But I kind of drew parallels to how the Liverpool Care Pathway was ended in 2013 because of not strict enough regulations put in place to pe things being done without people's consent. So I spoke about the importance of putting this in as, a regulation if we were to pass the assisted dying bill. So do you see if you see how I'm drawing parallels to what's important in this article with my own wider reading and own thoughts as well. So it's really important that you balance the two.
Mhm. So yeah, and that's very yeah. So I agree with all of that. And just to add on to that a little bit. The article will likely be something about the UK because obviously we're in the UK, but I don't think it's a bad idea to extend, especially with kind of a global problem. Sometimes the focus will be on kind of the NHS and the UK, but you can still bring in the relevance of the kind of the overall current affair globally. So that's what I did in terms of kind of looking at the global perspective. And generally, yeah, so there's just lots and lots of thoughts here. And I suggest you do this. You can kind of sit down with a friend maybe and talk about the problem, or you can do your own kind of research on the internet. Um, and in terms of the questions you might get asked about the article, I can almost guarantee that you probably get asked something about summarizing the article or something along that lines, just because it's a theme that comes up again and again in lots of years. So if there's a question you want to practice, it would be to summarize the article. And I suggest while summarizing the article, you also weave in your own opinion. So obviously, when you present an opinion, you shouldn't be polarizing and you shouldn't be just presenting one opinion. You should be evaluating and giving both sides of the argument because obviously any current affair will have two sides to the argument, and I'm sure a lot of you are aware of that from OJS's big group sessions. Um, and the other follow-up questions you might get asked might be to do with distinctions that are within the article. So, for example, you might get asked in this article, you might get asked about the difference between assisted dying and euthanasia. You might get asked, what legal change should happen, or what extra framework should we add, something like that. It would be, wouldn't be unreasonable. Um, So, and generally, pros and cons as well is something that you might get asked as well. For example, what are the pros and cons of something like what are the pros and cons of, pardon me, assisted dying, and things like that. So we're we're meant to end at 8:30, so I won't go on too long. But that's kind of my general overview of the article. And if you had to take one thing away, I'd say it would be to try and develop a unique perspective based on your own interests. And that would be kind of to do with so something in the article that's different to what might be the first thing that comes to your mind. So spend some time thinking about the article and what you might want to talk about it.
I think it's also worth mentioning opinion and analysis are two different things. So you can form an opinion and also analyze the article from kind of think about what failings does the article have, what biases can the article have, how could the article incorporate wider perspectives? That's one core component, and then the other is forming your own opinion on it. And then, of course, the summary, which I think someone asked a question about. And I'd say, as I said, that the summary is just purely descriptive. I'd say try not to go into too much analysis in your summary. Just show that you can give the key points of the article under pressure, and that you've understood what the article is trying to say, is what that question. How short should the summary be? I know we should end now, but I'll just answer. How short should the summary be? I'd say like maybe 1 to 2 minutes, trying not to. I mean, I don't know if you guys have anything to say about that, but I'd say not too long. Around 2 minutes would be a good point.
If the question is the summary and you start talking about your opinion, I think it's okay for it to be a little bit longer because they'll just in that's kind of what I experienced was when they asked me that kind of question, I just kept talking and they let me talk because I talked about both my opinions and the article itself. So it depends on the interviewer. If the interviewer decides that they want to move on to the question, they'll kind of kindly interrupt you and stop you and then move you on. And that shouldn't be too much of a that's a relatively normal thing to happen, so don't worry if that happens. And just to clarify, what are the three things they assess? It's not something they particularly assess, it's just something I find that commonly across all interviews, the three things that stand out as the most important things for good outcomes in interviews is kind of specificity, enthusiasm, and eloquence. So it's not in
Yeah.
particular what they assess.
Yeah.
Um,
Someone asked how many minutes should we expect the other questions to be? It's different for a panel interview. So I think Queen Mary was my only panel interview. Um, Yeah, so it's usually you don't get any designated thinking time, unfortunately. So you do have to kind of think on the spot, and they will interrupt you as you go along. So that's kind of a skill I would learn. Maybe just having a conversation with a friend about your article as well might really help. So I go Imperial, and I usually teach Imperial students. So the MMIs are usually much different because you have designated thinking time, and most medical interviews are MMI, unfortunately. So I think it does usually come with practice, and also recording yourself in a more conversational tone might help you with structuring your answer and also not running out of time. Because I think yeah, it's a lot of questions in a very short amount of time as well. It's about 20 minutes interview, I think.
Um,
How many questions are we expected to get on the article? Um, it's usually just what your thoughts on the article are, but they might ask follow-up questions, especially about something that you said. So I would have a good understanding of it and what your opinions and points are as well, just to kind of prepare yourself for anything.
So if there are any more questions, if you could put them in the chat, we'll try to answer them really quickly, but I do think we have to end soon. I think we started a little bit late, so I think we can end in kind of 3 or 4 minutes. So if anyone has any questions, otherwise we can end it there.
I just wanted to add a couple of things, just not about a question, but just general things about the article. So with the summary, I know you guys were discussing it to be about 1 to 2 minutes. I find that in the interview, the interviewers tend to ask follow-ups. So it's up to you if you really want your summary to be that long, because most likely the interviewers are going to ask follow-ups and it's going to be a lot more conversational. I know panel sounds quite intimidating, but Queen Mary's interviewers are like they tend to be really nice and they will probably make it more conversational, more friendly. So it's best to think of the summary as like think of it as you're summarizing it to a friend or a parent or a teacher or something like that, because that's what it's going to feel like. And then from there, it will just feel more conversational. So I wouldn't go on for too long just because the article section is only 10 minutes and I tend to advise questions to be like roughly 2 minutes long. Um, so yeah, just imagine it's probably going to be like they're probably going to follow it up with the questions. So don't ramble on too much because it's going to be more, at least mine was more conversational. And I know a lot of my friends last year, they said that theirs tended to be more conversational as well. Um, but yeah, another thing I wanted to add, if it's not already been said, is that when you're annotating your article, Panda is one very good thing to use, but also scanning through it once and just kind of looking at it from an ethical perspective. I annotated mine with pens, so like I color coded mine with one color for ethics, or like you could do one color for each pillar. And I think this is very important because it's very likely that they'd ask you something ethical with your article, especially because their articles like to be something about a current topic or anything that's happening at the moment that will have pros and cons. So, looking at it from an ethical lens definitely helps, and it will help you to make your answers more complex and just more insightful, I suppose, and it will sound more impressive as well if you look at things more ethically. Um, so 4 pillars, and also depending on where your article is, it could be to do with health inequalities or even people having more money than, poverty, things like that. And also if your article tends to be about something that's been proposed, for example, assisted dying, if there's something going wrong with it, then what can be done to improve the situation? And if you were a doctor, how would the situation affect you? What action would you take if, so this article was assisted dying. So if your patient wanted to go through with assisted dying, like what would be your thought process? They might not necessarily ask it, but to be thinking about it will really help you to develop your thoughts about the article and it will make answering questions about it a lot easier.
Just to answer
Yes.
the 5 questions in the chat about whether or not they'll ask about a personal statement in the interview. In my experience and from what I've heard from kind of like people around and from old years, etc., I don't think there's very much emphasis on the personal statement, at least for Queen Mary's. I still suggest learning it very well because I found that in some of my other interviews, I did get asked about my personal statement and I didn't quite know as well as I should have. So do learn your personal statement, but don't make it your emphasis for Queen Mary's in particular. In terms of if your interview is marked differently if you're contextual, I don't think it should be. I think it's just, I think the process is the same. And
Yeah, so just adding on to Jeannie's point real quick. So I think a lot of people were asking how to make your points unique, especially because it's hard to distinguish a great candidate from a good one. So I always say when it comes to an ethical dilemma, especially in the context of assisted dying, you could use the ethical pillars to kind of framework your answer as well. So here would be a question like assisted dying is fundamentally a question about autonomy versus protection. So how far the law should respect individual choice at end of life when safeguarding vulnerable people. And we spoke about a lot about healthcare inequities in East London as well. So you could speak about how that essentially goes against the medical ethic pillar of justice, because even though the NHS founding principle is free at the point of delivery and healthcare should be based on clinical need and not financial need, you could say that healthcare inequities arguably go against that. And I think that's a very unique point that you could add, especially in the healthcare inequity point side of things. Just like it kind of goes against everything that we founded and stood for essentially. So just small things like that are like frameworking your answers around the debates surrounding medical ethics rather than just listing them is a way that you could make it unique. I hope that helps with whoever asked that.
And any questions about kind of selection after interview? I'm going to refer you to OGIS's interview guide. Everything will be on there. In terms of it, how much is a UCAT used for selection after interview? I think a lot of it's very interview heavy after the interview process, but at least that's how it was when last year. Um, yeah, and again, this is one last question. Except to ask a question to the interviewer, I'd say don't force a question. Um, like don't ask a question just for the sake of asking a question because there's no like they've finished marking at that point. It's not going to help you if the purpose of the question is to try and push them in your favor. It's not going to do that. But if you're genuinely interested and you have a question, then go for it. I don't think there's any issue with that. But if that's everything, um I think we can finish this thing. There's one last question. If they ask you if there's anything you would like to say at any point, what would you recommend emphasizing? Do you mean like if you finish okay, so you said if you finish early, what should you emphasize? Well, that's up to you. So if there's no real like finishing early, I don't really think should be an issue because the interviewer will just ask you a follow-up question. But just make sure, like once you've read the article and had a look at the points in the article, what you think is the most important things to you, then use those to emphasize. Basically, use those as your points of emphasis. Is saying too much bad, not it's not detrimental to the quality of your answer, but like you can see me doing it now just as habit. But you should try and decrease it. And if you actively think about saying it should just help, and you should be able to decrease the amount of umming and ahhing you're doing. Ask if you're going to ask a question at the end, only ask a genuine question or a question you actually have about the university, about university life, teaching, etc. Don't ask anything kind of forcing. You don't need to have a particular question in mind unless you genuinely have a question about the interview. And curveball questions, I find generally for Queen Mary's aren't really that common because they have a kind of a pathway they're looking for, which should be they're talking about inequalities, they're talking about the article, and they're talking about qualities as a doctor and things like that. You might get the odd question that's something like, how does poor housing, I think this might have been a question like a couple of years ago or before that, how does poor housing affect healthcare outcomes? And there's obviously a lot of things you could talk about there. That's probably the most curveball I've heard of a question be. And that itself is still linked to healthcare inequalities. And you just talk about things like asbestos, lack of accessibility, things like Grenfell, etc. So I don't really think you should worry about curveball questions too much. And even if you do get a curveball question, the way you manage the question is more important than what you say as the answer. So if you give kind of like a slightly not very well developed answer, but you still have a good thought process behind it, it's not too much of an issue. But I think we've run over time now, so I think this would be a good place to end. If you have any more questions, OJS's group chats are always open, so you can ask them on there, or you can ask questions to him, etc.
Sounds great. Just one closing statement before we all leave. Don't stress too much about your Queen Mary's interview. They are very nice. And something that's unique about the Queen Mary's interview is that, at least for me, I got to speak to a medical student beforehand. I think they still do it. Do let me know, you guys in first year, if that's still
Yeah,
happening.
they did. Yeah.
Yeah.
I opened it.
Um, yeah, so you get to speak to a medical student beforehand, and it's not assessed or anything, and that calmed my nerves so much at the start. So, um, if you have any last minute questions, they will be happy to answer it. And I went into my interview laughing because I had such a good conversation, and it put me in such good stead for the rest of it that my interview just was a lovely conversation. So don't stress too much. I really hope all of these tips were useful to you. And like Krishik said, any more questions, feel free to ask.
You're very unlikely to get a statistic or a graph, in my opinion, so I wouldn't worry too much, Saad. But if that's everything, And yeah, so don't worry too much about that question. But if that's everything, I think this is a good place to end.